Okay. Yeah. All right. Well, welcome everybody to our second Animal Matters talk this week. This week we have, today we have Meera Gatlin. Meera is a teaching assistant professor in the Department of Infectious Disease and Global Health, my home department at Cummings School. She got her BA at Northwestern and got both her DVM and MPH at Cummings School. So now she runs the DVM MPH program from the vet school perspective, does a bunch of teaching, mentors 10 to 15 students at a time, and is working on working dogs and police dogs in particular. Yes. So that's what you will be talking to us about today. So thanks, Meera.
Thank you, Ellen. Can everybody hear me okay? Great. All right. Yes. So today's talk, thank you for joining me this afternoon, is going to be on working dogs, and very specifically police dogs or police canines and One Health. Oh, I can miss this. There we go. So our agenda for today, I want to introduce what are working dogs and police dogs, as well as what is One Health. This is a framework that I have been using because my first love in veterinary medicine is public health and One Health. This is a framework I've been using in my research on police dogs and how I've been using One Health to evaluate everything from working dog well-being to the human-animal bond and officer safety, as well as law enforcement and public health in the local community. As interludes, I'm going to introduce common types of police dogs, the three most common types that I've worked with, as well as my ongoing research. And we're going to wrap up today with why does this matter and some key takeaways. So a little bit about me. Thank you, Ellen, for that introduction. I did study veterinary medicine and public health here at Tufts, and I did go immediately into private practice after graduation. I worked as a small animal general practitioner here in Massachusetts for about 4 years with a focus on primary care, but I also had the privilege of training in canine reproduction. So I am trained in advanced reproductive techniques for dogs and developed a large breeder clientele and bred quite a few working dogs in the community. I didn't continue on as a reproductive specialist or theriogenologist because my first love is indeed public health. So I came back to Tufts in 2020, and I now teach veterinary public health, and I oversee the DVM MPH program here. Even though I'm here at Tufts teaching public health primarily, I did retain those breeder relationships. I lecture in canine reproduction for second and third years, and I run a selective program for veterinary students that are interested in purpose-bred and purebred dog health. For this, I partner with the American Kennel Club, and I rely heavily on breeder mentorship in the local community. I'm a big fan of local community, and that's very much going to be a feature of today's talk. I did specialize in veterinary public health, became board certified about 2 years ago, and a core tenet of veterinary public health is asking, how do human-animal interactions and good animal health impact public health? So I wanted to bring all these interests and experiences together, and I sort of backed my way into working dog health research and settled more specifically on police dogs. I do continue to practice as a local general practitioner, now as a relief vet from time to time, and I have the privilege of caring for a local PD canine unit. All right, so what are working dogs? These dogs are tasked with a specific job, traditionally outside of companionship, which is how we often think about dogs, particularly here in the United States. Depending on the breed, these responsibilities for working dogs include hunting, livestock guardianship, herding, transportation, and police work. And I would argue that police canines are actually among the most recognizable working dogs in U.S. society. When we look at canine responsibilities, there's quite a breadth of it. I'm going to pull them all up, actually. We have everything from scent detection to explosive detections and narcotics, tracking people or objects of interest. And that can include tracking of criminogenic commodities. That includes explosives, firearms, and illicit drugs, such as narcotics, or articles associated with people. Police canines are also trained in suspect apprehension, which by case law is a non-lethal use of force. These canines are known as patrol dogs, which I'll feature later on. Police canines are also trained in comfort, or can be trained in comfort, during times of tragedy or trauma, also known as comfort canines, and I'll also feature that later on. Do note the stylization of canines that's commonly used throughout this presentation. I will say there are a lot more skills that police canines have, other unique capabilities like accelerant detection, electronics detection, currency detection, search and rescue, live human searches, and human remains recovery. So lots of opportunity to tap into some of those working dog skills, but I'm going to feature some of these as the most classic ones. And of course, there is a variety of dog breeds to go with all of those skills. And I'm going to use the AKC groupings when I describe many of these dog breeds. Starting on the bottom right, we have the Belgian Shepherd group, everything from the ever popular, let's see, this will go. Oh, you got a cursor there. Belgian Malinois, which is your quintessential farm dog, actually, and is very popular in police canine for patrol duties. Next to that is the Belgian Laekenois, the Groenendael, and Tavern. I think I have that flipped, actually. And then, of course, the iconic German Shepherd right there. These are all our herding dogs, and I can speak with experience having herding dogs. Their drive and their motivation to work, which is what drive is, as well as some of those nipping or biting tendencies that is then utilized by police. My corgis just herd my children. I don't have any livestock to herd. We also have the popular sporting group, which includes the Spaniels and Retrievers. So you have the 3 Labrador Retriever colors there recognized, as well as German short-haired pointers, which is a breed I actually love. And of course, you have the Hound group as well, known for their olfactory capabilities, so Beagles and Bloodhounds. There are other types of working dogs that are actually classified at the AKC working group, and that includes Dobermans and Rottweilers, which are popular for personal protection, Newfoundlands for water rescue, and even Bernese Mountain Dogs for snow rescue. So a lot of different breeds, but I would say the most popular ones for police are pictured here. All right. So moving on to One Health, I have a handful of my students that I recognize in the audience today, so this will be ever familiar to them. But just so we're all on the same page, I do want to introduce this concept of One Health. It's a framework that goes beyond traditional public health, which classically focuses on humans. If you look at the definition here, it's a multi-sectoral and transdisciplinary approach, working at various levels to achieve optimal health and well-being, recognizing the interconnections between people, animals, plants, and their shared environment. And so it goes beyond the unidirectional approach that public health often has and looks at sort of multi-directional relationships. And it's been essential for addressing adverse health outcomes related to emerging zoonotic diseases, global pandemics, antimicrobial resistance, food safety and food security, et cetera. I do want to introduce a different perspective on this framework. And again, my students will recognize this image because it's something I use in my lectures as well. Julianne Meisner and colleagues published this diagram on the right last year to better showcase the distribution of health in a different way when it comes to One Health. And so we see humans subsumed by non-human animals, or animals for simplicity, subsumed by ecosystems, including biotic and abiotic components. And they argue that there is a distribution of health across this system, and they share a common environment. And that distribution of health within the environment is more than just biophysical, when, what we think about environment, but also includes our social environment, cultural, political, historical environment, et cetera. It's just another way of thinking about health, and is very important, I think, informative for the kind of research that I am looking to do and have done with police canines. I'm going to use the original diagram just because it's familiar and simpler, and as I mentioned, has been essential for addressing a lot of biomedical health concerns. But I think it can lend itself to more than that with fields like mental health, injury control and prevention, and even public safety when we think about how the different disciplines and sectors can collaborate. And we've actually seen public health's role in public safety when we look at something like motor vehicle safety, which is actually the second greatest public health achievement of the 20th century for something like seatbelt laws, for example. And so we ask ourselves, or I ask myself, can we substitute health for safety when we evaluate law enforcement and police canines? And it certainly invokes social determinants of health and other environmental dimensions, as we saw in Dr. Meisner's diagram. Public safety is classically about crimes, disasters, dangers of threats, et cetera. So if we consider the definition of health, particularly the World Health Organization's definition of health, as the absence of disease or promotion of healthy behaviors, then the analogy of safety implies the absence of crime or danger and the promotion of safe spaces. So I wanted to see if we could reconstruct this diagram for public safety with law enforcement and canines. And so this is an image from my paper, looking at how this framework can help us evaluate law enforcement and police canine relationships with the community and better assess public safety using One Health. And safety often lends itself to security, as we see with food safety and food security, which is a sense of physical and emotional and social security, implying assurance with high temporality and high probability. So I did want to keep those long-term aspects in mind. And so going back to one of the points I had earlier about how do human-animal interactions and good animal health impact public health, I wanted to think about how can we use One Health in this way? How do we ensure the benefits of police canines for community health and safety? And so can we look at working dog well-being, officer safety and canine partnership, and then the duo's efforts in built environments and local neighborhoods as sort of the environmental component. Keep in mind that One Health is inherently very transdisciplinary and requires collaboration with multiple disciplines from scientific and non-scientific sources. So one could argue that this is true for public safety as well. And working with local law enforcement has been a primary objective of mine for all of the research I'm about to present. But it's also important to consider partnerships with working dog breeders, working dog trainers, Department of Public Works, Department of Public Safety, et cetera. And so within this diagram, I have a few different frameworks that I'm going to actually go into. So we'll look at all three of these. A few disclaimers as I proceed with the presentation and research. Very much going to focus on municipal police canines and their handlers in this talk. That's the focus of my research. I have no experience with military working dogs, federal or even state police canines. I really value community engagement and local community health. That's my area of interest, and all those different levels One Health can apply itself to. I think there's a really profound opportunity to explore so much at the local level, from assessing health to policy development to assurance of services. I will also say the majority of our operational canines here are at the municipal level. I'm also not a criminologist, so I'm going to describe a lot of police canine phenomena that I've learned throughout my research, but I have no law enforcement background by any means. So this presentation isn't a commentary on policing, and I'm really going to try and stay in the camp of health for both individuals and populations. And I also recognize that talking about law enforcement and canines can be a sensitive subject. So, all right. The first framework I want to talk about is working dog well-being and the relationship that the canines have with their handlers, but specifically about the dogs themselves. And I think veterinary public health is an ideal perspective for this. I teach the students about how good human-animal interactions and good animal health can really impact public health. And an ideal framework is animal-assisted interventions. This is a broad term to describe the utilization of animals in a manner that's beneficial to humans. And classically, this definition has applied to therapy, education, and facility dogs that render services to a population. It doesn't really apply to service or emotional support dogs because they're procured for individual benefit. So when we look at AAI frameworks, there's a few different criteria that I think, again, are potentially applicable to police dogs themselves. The animal acts as an intervening force to enhance treatment or ameliorative processes. They uphold basic training standards. This is actually a very interesting area, and I will talk quite a bit about training throughout this presentation. They regularly document services rendered. So when police canine deployments occur, and deployment, the general term is when they come out of the vehicle and are used for a task with which they're trained in, those services have to be documented. And again, I'm going to feature some of the research on documenting those services as well. They deliver services with a responsible professional, or RP, and are within scope. So of course, the canine handler team. And the service must be goal-oriented and add value to well-being. And so some of the questions that kind of arise from looking at working dog well-being with AAI, for example, what does it mean for a police dog, or really any working dog, to have good welfare? And a great example I've come across in my research is actually regarding housing. Many working canines, including police canines, are housed outdoors. And I don't mean tethered to a stake and left to the elements, but properly with structure and shelter as pictured here. And for some working dogs, like livestock guardian dogs, they need to do this for their job. However, housing dogs outdoors for most of their life is actually a very polarizing concept to people. And bills have been proposed, even here in Massachusetts, actually, to prevent or restrict the outdoor housing of police canines. But I argue that it actually makes sense when you think about the tasks that these dogs are asked to do. Indoor dwelling pets often have boundaries in place, even if we don't acknowledge those boundaries, like coming onto my sofa or counter surfing. But when police canines have to do work, they may need to jump on beds or bookcases or surf the counters, and those are not behaviors we necessarily want in the home. And if they're discouraged indoors, they may not perform when they're asked to do so when they're working. Exposure to elements also ensures that they're willing to work within those elements. And once they're familiar with the comforts of an indoor dwelling, some argue that they're less likely to do the work in inclement weather, for example. A lot of the handlers that I've worked with are very mindful of extreme temperatures, and so when those dogs are exposed to temperatures, say greater than 85 or 90 degrees Fahrenheit or less than 20 degrees Fahrenheit here in New England, they'll often bring them indoors to like a garage or a basement, so that they're just out of those elements. But housing is, like I said, something very polarizing and something that has been subject to public policy. Another example, one that I'm actually particularly interested in, is what is the ideal working dog? Or how do we optimize genetics, health screenings, and breeding programs for ideal working dogs? And the Labrador Retriever is an interesting thought exercise in this. These dogs have historically been bred for sport, but are very driven to assist people. Everything from field work to birding and hunting and dock diving. But they're also incredibly biddable, and they have those baby mouths. And so they're great for birding because they're very gentle. And so they make for good companions as well. That companionship has been capitalized upon to breed labs for companionship or work together, such as with service dogs or comfort canines, which I'll discuss later. And that kind of work and relationship really requires docile dogs and perhaps counters the driven nature for sporting that they're known to have. So it's not a criticism of service dogs or comfort canines or anything, but a really interesting example of how dogs were once bred for something, and those specific traits have been refined for another purpose, but perhaps at the loss or exchange of other desirable traits like athleticism or high energy. And so people often talk about show line labs and field line labs. And I think this is an excellent area of dialogue for or with working dog breeders. I have 2 show line corgis myself, so I'm very familiar with a lot of the herding instincts, but they're very much couch potatoes, and they're certainly not working line. So it's very interesting to see some of these different dynamics with breed characteristics that we are trying to optimize. So with this in mind, I want to introduce the first research project that I'm working on actively right now, and this is a nationwide police canine survey, recognizing that there's a dearth of data on active police canines in the United States. This research is actually in partnership with Dr. Cynthia Otto at the Penn Vet Working Dog Center. She's a premier researcher in working dog health, and it's been an incredible project so far. And what we're gathering is handler and canine demographics, as well as canine training and certification efforts across the country in efforts to better characterize what is it that officers do. And so we are looking at, for canine demographics, things such as breed, the purpose of the canine, how they are housed, as I've just discussed, community size served. With training, we're looking at both training time and training equipment, as well as certification efforts. Training and certification is really important for police canines because it certainly lends itself to their credibility, particularly in court. And so some of the project findings we have so far, we have about 450 completed surveys. You can see representation is pretty high for mid or South Atlantic states. A vast majority of our officers actually serve small or medium communities with populations less than 100,000 residents. 68% had Belgian or German Shepherds, only about 14% use labs, and then the rest are sort of other breeds that are less popular. And about 1/3 of our officers have been trained in patrol, tracking, narcotics, and article search. So definitely we'll reference the dual purpose nature of most of these canines later on, but you can see they're often trained in multiple things. And of course, housing, this I think is actually very interesting, that there's a pretty even spread between outdoor housing, indoor home kennels, and then freely housed in the home. And then for handler demographics, most were actually white males in the age range of 25 to 44. And so these are all explanatory variables here, but we do have an outcome variable we're looking at. Before I get to that, I would like to introduce the first of 3 sort of most common police canines that I've worked with, and that's patrol canines. And I'd say these are the most popular ones, most recognizable ones. And these are canines trained in suspect apprehension. Apprehension is an important term. Some people will colloquially refer to them as attack, and that's incorrect. Suspect apprehension are tactics that are actually derived from personal protection sports. So for those of you familiar with Schutzhund or IGP or Mondioring, these are dogs that people will train in personal protection. And so a lot of the tactics come from that. In Schutzhund, for example, the dogs are trained in basic obedience, followed by tracking, followed only then by bite work. So there's very much a structure and a hierarchy to how these dogs are trained in these skills. With suspect apprehension, from my own sort of personal understanding, I classify them into apprehension types. There can be display apprehension, where the canine can come out of the vehicle and be used in a heightened situation just through display. So the dogs are actually not deployed to bite. And then following that, there can be bite apprehension, where the canine is then allowed to apprehend the suspect using a full mouth grip, and that pain compliance is deemed a bite apprehension. This is a non-lethal use of force per case law here in the United States. Patrol canines are valued by law enforcement for crime deterrence as well as de-escalation. As I mentioned, that like display apprehension where they come out and are just visible in the scenario is really well described by a lot of law enforcement. These canines are also often co-trained in tracking or article searches, as I showed you with some of that data, but also trained in other types of purposes like scent detection, so I'll show that later on. And the very popular breed, two popular breeds I would say for this, are German Shepherds or Belgian Malinois, or mixes of these kinds, and I've seen occasionally Dutch Shepherds as well. All right, so back to the project findings. I did want to show some of the training time that we sort of gathered. Average minimum training hours in 30 days. Quite a bit is dedicated to formal scent detection. And so when I say formal, these are organized efforts by law enforcement to offer scent detection training. It's actually at about 8 to 9 hours in a month compared to tracking or patrol, which is only about 4 or 4.5 hours. Informal training time is actually similar to the scent detection. Individuals reported they committed to about 8 hours of informal training. And so that's stuff that they do on their own. Certification is really interesting. Some states, but not many, require canines and handlers to be certified. And this is really interesting when you think about how canines are used similar to other tools like firearms or tasers. But regulations are actually far less strict generally with canines than it is with other tools. So we asked handlers to describe how often they certify and where they certify. There are many national interest agencies that have taken it upon themselves to confer certification, and they have a lot of merit because these membership comprise only of law enforcement canine handlers, and it's really well recognized by law enforcement as a community. It's really not, in some ways, dissimilar to our veterinary specialty colleges. And so we found about 40% of respondents certify at their state or with state and national agencies, and about 80% certify on an annual basis. And again, that's important for credibility and recognition. The other thing we asked about was training equipment. So we wanted to learn about how are they training, and I'm going to get to the human-animal bond later, but how are they bonding with their canine as well? And so you can see there's a high percentage of those that use toys over food for training, only using verbal or voice markers, and then standard leads. Long lines are typically much greater than like 10 or 15 feet, a harness, and a flat collar. Okay. Not many handlers use ear protection or eye protection, but about 50% will use a bulletproof vest. And so more to come on that. And as I explained, we are actually looking at an outcome variable. It was not simply descriptive. And the outcome we wanted to assess was related to patrol canine use for de-escalation, which is why I introduced patrol canines here. And we wanted to understand, well, how do some of these training and certification efforts translate to deployments and de-escalation? So we asked all our patrol canine handlers to finish the survey by self-reporting apprehension outcomes to see how they view the effectiveness of their own dogs in a heightened situation. Okay, so this is very much self-reported data. And the assessment is really about public safety more than sort of physiologic health, but we wanted to see how they characterize that de-escalation. And so that data is forthcoming. And the last question we asked about was veterinary attention and the circumstances with which their canine needed veterinary attention. So about 4.5% of our respondents had a canine that needed veterinary attention, and the vast majority of that was due to blunt trauma. All right. Moving on, I want to talk about the human-animal bond. This is the second of the 3 frameworks I want to introduce. And in 1990, S.G. Chapman had published a book on police dogs in North America. That's actually what it was titled. And this is a source that's still referenced by law enforcement today. And in it, he outlines 5 main advantages of police canines in North America: psychological intimidation and crime deterrence, which we've kind of discussed in the previous framework, night detection, officer safety, and public relations. And so I really want to move on to officer safety and public relations. And I want to use the human-animal bond studies to sort of look at that. And so the AVMA defines the human-animal bond as a mutually beneficial and dynamic relationship between people and animals influenced by behaviors that are essential to the health and well-being of both. I will say that animal-assisted intervention frameworks are very much predicated on the strength of this bond. We know that law enforcement is prone to stressful and traumatic situations in the line of duty, and so they are at increased vulnerability for psychological and mental health issues compared to the general population. And more data is really needed on the role and relationship of canines and their handlers when it comes to officer safety, and not just physical safety, but emotional and psychological as well. And there is some research out of search and rescue dogs that definitely suggests that canine partnership is very protective to their handlers when it comes to mental health assessments. I believe they looked at PTSD. And so I want to talk about the spectrum and the breadth that a canine can have, or handler can have with their canine, because it's very insightful, I think. So this spectrum is based off of two anthropologists, Hosey and Melfi, who described human-animal interactions on this scale. On one end, we have emotionality, where most people think about companionship and affective relationships. So a good example of that, there are my two corgis. On the other end is instrumentality, where we focus on the very utilitarian aspects of a human-animal interaction. So I have a donkey pictured here, often used for labor and traction. Now, it goes without saying that these are not mutually exclusive, and of course the point is that police canines very much straddle the spectrum in very unique ways. And so when we characterize the relationship canines and handlers have, the human-animal bond on the spectrum, there are sort of four common thought processes. And this is based off the work of C.R. Sanders out of, I believe it was an anthropologist out of Connecticut who did this research about over 20 years ago at this point, but I think it's still very applicable today. On the emotionality side of things, the relationship can be seen as canines as pets or canines as children. And as we move to instrumentality, well, those canines can be also seen as partners or even as tools. And even within the tools, there is a sort of mini spectrum that one can think about. These canines can be tools of comfort, tools of public relations and engagement, or tools of weaponry. And the green suggests that police canines are used more therapeutically, right, for comfort or victim assistance, socially at community events, helping find missing people. And the green means that they're valued and celebrated within local communities. But in red, they can also be used for suspect apprehension, and that pain compliance, that full mouth bite, can result in officer or suspect injury, and maybe less well received by a community. Excuse me. And so what's compelling to me is how this span of duties and this variety of relationships really mirrors the role of local law enforcement in society today. I think these dogs certainly reflect all of the different perceptions we have of law enforcement, and that relationship, I think, then is even more important. So what does it mean for an officer canine team to be successful? With all these relationships in mind, how do we assess officer canine teams in the community? For example, if an article search for a weapon results in no find, is the work a failure despite the dog doing the job it was tasked with alongside its handler? In other words, does a negative outcome always warrant a negative assessment of the team? In another example, a negative search for an explosive device is actually valuable, and informing the rest of the team that the area is clear of articles or suspects has intrinsic value for safety and efficiency when it comes to resource deployment. And so we think about, how do we evaluate this human-animal bond? What does this relationship tell us about the work that the duo could do in a community? And I think a great opportunity for intrinsic evaluation is through training. Training provides law enforcement and civil society partnerships. We can potentially affect police organizational culture in a good way, maybe enhance police legitimacy, and I think makes for a great One Health study. This is the next project I want to introduce. And this is actually a project that's funded by the Centers for Animals and Public Policy with support of the Elizabeth Lawrence Grant, so I want to thank them today for that. And the research project that I'm working on here is, how does training facilitate the human-animal bond and local public safety? I connected with at least 2 local law enforcement training academies between Massachusetts and New Hampshire, and I've been following them this past year to look at a variety of different characteristics. I use a combination of semi-structured field interviews as well as ethnography, gathering demographic and training information, their perceptions of the human-animal bond, and perceptions that they have of public safety. And the goal was to better capture the dynamics of the canine-handler relationship and their capacity for the teamwork to inform both physical and psychological safety. So a couple of findings here. Most of the law enforcement officers I've been working with have been an officer for at least a decade, but canine handlers for about 4 years. So most of them are on their first canine. The project started with primarily patrol canine units. That's who I connected with and started following. So I have a vast majority of the handlers I've interviewed and observed have shepherds. And when I say even split, German shepherds and then Belgian Malinois, all trained in patrol. And what I want to point out here is a vast majority of them here in New England are dual purpose trained. So they're patrol with a scent detection. And the majority of those are trained in narcotics detection. And I have a graph later I'll show you that I think will be really interesting. I moved on to comfort canines as part of this research just through word of mouth and connections because, again, they are a very interesting study in the different kinds of roles and responsibilities we see in law enforcement today. So a couple of those canines are trained in comfort. All of them were Labrador retrievers, and one of them was actually dual purpose scent detection and comfort, which again goes back to the Labrador discussion about having the drive for scent detection or the docility for comfort are both possible. So introducing comfort canines. What are they? They are peer therapy dogs for emotional support and wellness, and they offer this support in times of tragedy, trauma, or sensitivity. And their positive interactions with people really leverage the power of the human-animal bond. I would say here regionally, it's a rising phenomenon. Got to connect with a lot of police canine handlers that had comfort canines, and it's very interesting to see, again, the roles and responsibilities we expect of law enforcement. Many of these canines are paired with school resource officers, so for me as a public health researcher, the role of dogs and canines and law enforcement in vulnerable populations like schools, I think is very interesting. These comfort canines have no formal training, which again is a very interesting finding of my research. Patrol canines and scent detection canines have to maintain their skills. They don't use them every day, particularly in municipalities. They're not apprehending suspects daily or finding explosive devices daily. It can happen, but there's certainly not always regularity to it. So they need to maintain those skills, hence the large amount of time dedicated to their patrol skills or scent detection skills. But comfort canines, their handlers argue that they don't need formal training because they do it every day. We're tapping in sort of, again, the intrinsic nature, particularly of these Labrador retrievers, leveraging that human-animal bond, and so they're training beyond basic obedience on a daily basis with their communities. And so most comfort canines, as I mentioned, are Labrador retrievers. That biddable nature and that docility is really important, but I've also met a few doodles, so Labradoodles or Bernedoodles. Zip here. Something interesting that came out of this research with the human-animal bond is the perceptions people have and the way law enforcement and canines convey themselves in a community. And so on the left here, I have canine Molly, who I've renamed here just for privacy. A canine Molly, I cut it out of the cruiser image so that I didn't have the department identified, but most of these patrol canines vehicles have a red caution canine or stand back canine kind of signage. And they're paired with handlers who wear dark blue or dark black tactical outfits with a chest carrier and all their equipment sort of highly visible. In contrast, comfort canines and their handlers approach this very differently. They want to be, approachable or engage in a different way with the community. So all the handlers that I spoke to do not wear any of the traditional police gear. They wear khakis or slacks with a dark polo and logo of the department, so they're recognizable. They have very minimal equipment on their belt. And you can see here's Hubert hanging out with a student in his crash pad at the school. And so very different sort of engagement with the community just based on, again, appeal and signage alone. I was chatting with the canine handler on Friday for this picture of Hubert, and I did want to share that the student that's pictured with Hubert is now a local law enforcement officer in Massachusetts and credits the positive interactions with their school resource officer and Hubert here. So good story that came out of that. Other things from this human-animal bond project, the average formal training time here for all our patrol canines or scent detection canines was 19 hours, which is much higher than what we found nationwide. And these canine handlers are training in regional academies, regional LEPHs, or law enforcement councils, as well as department units itself. 60% explicitly stated that they train informally on a daily basis. And I did ask how they felt about their training standards. This is really interesting to me because Massachusetts and New Hampshire do not have any state policy when it comes to training canines or training requirements. So that decision is left up to the individual department, and we have a lot of them here in Massachusetts. And I think that's really interesting, again, when you compare it to other weapons like firearms and tasers. But the vast majority of respondents actually felt like they had a say in how their department was setting aside policy for training standards, again, deeming them adequate or more than adequate. And a lot of time is dedicated at the department level to thinking about the resources necessary to maintain a canine unit and the time dedicated to upkeeping a lot of those skills. And attending some of these trainings, I think, was the best part of this research. I was really privileged to see how they use these canines. Police are a very insular unit, so to be able to join and observe and document some of these things, again, was some of the best part of this research. And I saw incredible power in the regional academies and law enforcement councils from these partnerships. There were shared resources, shared mentalities. All of these officers from different municipalities were coming together and working as one for these really real scenarios that they were trying to recreate to support their training and their skills. So a lot of the qualitative findings are still forthcoming. I have a student assisting me this summer, so looking for a publication on that, hopefully by the end of summer. The last thing I want to share on this project is something I thought was really interesting. What I have and what I want to picture here is, these are not all of the departments and handlers I spoke to, but representative to the best of my abilities on paint. So we have Massachusetts with the localities here, and then anything outside of the state borders is New Hampshire. You can see 70% or more had dual-purpose patrol narcotics canines, and the remainder were patrol EOD canines. And if you notice the distribution of patrol EOD canines, they're all along the eastern border of the states, versus the narcotics canines are sort of widespread throughout. And that is because what I was told by the handlers is after the 2012 Boston Marathon bombings, which was as a result of a homemade explosive device, that a lot of resources and time went into the localities surrounding Boston to dedicate to canines trained in explosive detection. As you move into central and western Massachusetts, that sort of falls off. And so the majority of those canines, if not all, are trained in narcotics detection, particularly given the state's opioid crisis. And so again, I see some very applicable public health concerns here. Right. The last framework I want to present today is law enforcement and public health, which is really meant to connect law enforcement with their communities. And we've seen this when we think about things like disaster response and mental health, but I think it's also applicable to injury control and violence prevention and public safety in general. At their core, public health and law enforcement share very similar principles. They assess and regulate human behavior. They engage with their physical and social environments and have to regularly balance the recognition of individual liberties against the greater good. I teach a public health law class to my students, and so I'm always talking about individual liberties and the greater good in the context of public health, but I think this is very true in law enforcement as well. And it's within the domain of veterinary public health to promote and ensure the beneficial use of animals in society, and I think this can include, arguably, measures for public safety using working dogs. And so an ideal consideration here, and what I want to talk about with LEPH, is community policing. Akin to public health, community policing emphasizes prevention through safety promotion, reduction in criminogenic exposures, and community outreach. And I think canines are the perfect tool for all those. I do want to share that there is actually an association, an international association dedicated to LEPH, the Global Law Enforcement and Public Health Association, and you can see their mission and aims here. And they do hold annual conferences, which I'm excited to engage with. So the first of the two sort of environmental contexts I want to talk about is the built environment. I will also talk about social environment and local neighborhoods. We want to avoid the common one health fallacy that tends to occur when we disregard the environment. It's very easy for those of us trained in health professions to think about animal health or human health and those connections, but I think environmental health is equally important, and One Health is trying to do a better job of engaging with that. So I want to think about the built environment, and this is as defined as man-made spaces for human activity and recreation, so buildings, public infrastructure, transportation, open spaces, right? These have long been studied with health impacts on how they affect populations where we live, where we work, where we play. And so I want to think about some of the occupational hazards from the built environment for both canines and their handlers. Health outcomes from longitudinal studies on search and rescue dogs deployed after 9/11 aftermath was a sort of inciting study in this particular field. And they actually found not very many differences between the 9/11 search and rescue dogs to control population of search and rescue dogs, but this is rooted in a specific incident. And so I previously mentioned that the impact of human-animal bond and officer sort of psychological health is an area of interest of mine. And so I think it would be my dream future study, it's kind of a desired area of future research, to conduct a longitudinal occupational health study on police canines and their officers. I'd love to partner with a police physician and study risk factors and long-term sequelae of occupational hazards for both canines and their handlers, and that includes both psychological and physiologic health. So I also want to talk about the social environment. I talked about community policing, and I think this is where it's most relevant. Of course, in tandem with the built environment, we should consider the structural determinants and social determinants of health. If you remember, one of Chapman's claims for police canine benefits is public relations. So really looking at the social environment when it comes to community policing. As we discussed, canines are highly visible and we can leverage the power of the human-animal bond. And I think this is actually applicable to both patrol and comfort canines. I talked about the comfort canine example, and I think that's pretty evident. But a lot of the patrol canine handlers I spoke to said, even though people couldn't approach their dog or their dogs are not particularly social, just the ability to connect with the community, talking about what they do, maybe showcasing what they do with the demo, allows them to engage with their communities in a very different way. So I think we're still able to leverage that human-animal bond in other ways with both patrol and comfort canines. I think perceptions to police, and specifically police canines, vary considerably based on social context. And the importance of non-punitive contact when it comes to municipal law enforcement cannot be underscored enough. Research that actually happened here in New England has highlighted the importance of one single non-punitive contact between law enforcement and the community. And again, I think canines are an incredible tool in this case. And we want to think about long-term safety, including safety promotion, reduction of those exposures, criminogenic exposures, and community outreach. So I show an interesting example here, using social media to engage with the community. So this is from a department nowhere here in New England. I have no association with it. It's halfway across the country. But what I want to show is a social media post where they're wishing Sparky, canine Sparky, happy birthday, turns 2 years old, followed by a social media post on kid safety training. And what I want to point out is just what struck out to me was the engagement, the level of engagement with likes and comments. And so for canine Sparky, you can see there are 678 likes or hearts and 142 comments and shares versus the kid safety training, which as a parent, I think I'd be interested in, but 6 comments and 46 hearts or likes. And I realize the premise of this social media post engagement is different. One is wishing a canine happy birthday, another one is asking questions about kid safety training, but I think I see this repeatedly in social media where canines, again, are highly visible, and that human-animal bond or that visibility resonates with people in a way that I think is important. The last project I want to talk about is a local city police department collaboration. And this is actually the project that started it all for me. I reached out to a local police department to learn about how they use canines in their community. And as part of that assessment, I partnered with a canine handler and trainer to learn as much as I could. And so we asked, how are canines used in this community? We did all the necessary paperwork to access the data and conducted a retrospective analysis of their canine deployments. So again, every time the canine came out of the vehicle and it was logged in a 6-year time frame. This is something I love, again, about sort of reaffirming my love of local community health. Because as much as it was an internal evaluation for the department's benefit, it was also a learning exercise for me, which was a win-win. I got to work with the entire department's command staff, who are really engaged in trying to understand the data. So a lot of the superiors don't sometimes understand what is happening at the patrolman level, or maybe have, not kept up or something. So I think they were really wonderful in trying to understand the data and really thinking about their community and community's health. So the findings, we looked at a number of different variables with the outcome similar to the first one being apprehension data. And so we found no significant association between the year, so we looked at 6 different years of data, the shift, police officers work in a day shift, a first shift, which is in the evening, or a last shift, which is overnight. We looked at handlers, I looked at handler ID, this is all de-identified data, and we also looked at suspect race to see if there was any association with apprehension. There was not. What was significant was certain types of canine deployments, and so when patrol canines were deployed for arrests, when they were deployed for building searches, and when they were deployed for tracks, did have a significant outcome with apprehension. And what I thought was really interesting is this department did not log any of their community policing activities, so anytime the canine came out to engage with a senior center or a school or a community event happening, they didn't log that in their deployments. And so we had a very robust discussion, I actually really enjoyed that, about trying to see, is the canine being used for the purpose with which it was tasked? Some would say yes. Most said yes, I think a couple said no, but they were worried that adding that community policing would pad the data. These records are important for police department accreditation at the state or federal level, for justice inquiry, Department of Justice inquiries, et cetera. So think they were very worried about whether it would pad the data or not, but I argued that they needed to highlight that community policing aspect as much as they had some of the other information. Now, what remains outstanding in this project is moving from an intrinsic evaluation, because this is all internal, to something more external with the community and community perceptions of canines and their handlers. So that's to be coming for this project. A published study that comes to mind that attempted to document this actually documented negative associations of a law enforcement officer, and more likely so when they were pictured with a canine. But that particular study was done on a neutral survey platform with a general population, generally accessible population, and I think it lacked the local community context that's necessary to gather this data as it is relevant for the specific community. So last few slides, what I want to highlight is the third of the final canines I'm going to feature in this presentation, and that's scent detection. So scent detection canines are trained to assess common substances. As I mentioned, narcotics or explosives, but they can also seek out live humans, human remains, accelerants, plant and animal species, and even medical conditions. The canine's olfactory competence is really well documented by a number of veterinary researchers and PhD researchers, and it really underscores how they are the ultimate biosensor, right? A lot of the scent detection training similarly has tactics related to scent work sports. In scent work sports, they use, like nose work, they use different essential oils, so obviously a different thing to detect. Many of these canines are dual purpose trained with patrol, and we see everything from Labrador retrievers in scent detection to bloodhounds and even German short-haired pointers. And scent detection, again, is a very interesting area of research. The local PD I worked with for that project is more urban and had a balance of canines trained in narcotics as well as explosives, so fairly evenly trained. And they really underscored problems with both opioids as well as firearms in their community, which are subject to public health scrutiny, and, have been declared public health threats, in fact, either here in Massachusetts or nationwide. So the opportunity, I think, to use scent detection canines is very timely and very relevant. Thanks to the Elizabeth Lawrence grant, actually, we purchased a scent detection training kit for one of the regional academies, so a couple of officers pictured here with their canines, and the kit that was purchased. So I want to wrap up with why does this matter? We are in an era of police reform. Police are very much under public scrutiny, and that includes canines as well. And a good example of this is the 2023 California Bill AB 472. In 2023, state legislators in California proposed this bill to ban police canines for apprehension purposes, citing racially mediated usage and deadly consequences for the bite victims. But in response, law enforcement cited claims of canine effectiveness to protect their officers, as well as defending against lethal weapon use. They felt that by using the canines non-lethally, they didn't have to resort to using firearms, which is lethal. The bill was moved to inactive status due to a lack of support, but it really underscores the need for robust empirical evidence on the impacts of police canines and highlights the need for transdisciplinary approaches to understand and refine what is their societal contribution. I really would like to know, do canines have a role or a risk? And as a veterinarian, as a public health researcher, I'd like to advocate for the fact that they have a role, that they are beneficial to society, but we need more data to do that, and partnerships. I also want to speak as a veterinarian. I would argue that veterinary public health is far more than just infectious diseases. We classically have considered our advantage in zoonotic disease research, and in this realm, often considered for things like dog bite injury or transmission of zoonoses during a dog bite. But I think this emphasis detracts from the ability for public health and law enforcement to collaborate on local society needs. As I mentioned, my specific area of interest in this is actually occupational health and safety. And so looking at things like human-animal bond and canine welfare, I think there's more to veterinary public health than just infectious diseases. I'm also very passionate that veterinarians are leaders in their local community. Many of the handlers, all of the handlers I think I've spoken to, honestly, have a tremendous relationship with their local veterinarians for primary care. And they speak highly of them in regards to their canines' needs. Many of the vets practice in the community that these law enforcement serve. So there really is a community engagement aspect that was incredible to listen to. We see the power of local community health and the opportunity for veterinarians to be leaders in their community with a primary care and preventive care focus. All right, so key takeaways. Law enforcement plays a vital role in public health and safety, and veterinary public health can support that. I think a One Health framework can support everything from working dog well-being to officer safety and canine partnership, as well as efforts in built environments and local neighborhoods. And I think canine handlers themselves are a fabulous resource for us to use as veterinarians and veterinary care teams, as well as researchers to engage with supporting working dogs. They really have untapped experiential wisdom and a realistic perspective of what is and isn't doable. And that special and dynamic bond is sort of the core of that. Public health is often conclusive with public policy, and so as we move into an era of reform of law and policy, I think these relationships will be essential to cultivate. And One Health is championed when there's recognition of that the sum is greater than any individual part. And so I think providing evidence-based research on best practices is necessary for police canines in local communities. And so with that, I'd be happy to take any questions. And in honor of April Fool's Day, I found some really funny social media posts on other species with police departments. So until that actually happens, we'll stick to canines. Are there any questions in the chat? Okay, great.
That was a very interesting presentation. Thank you. So my questions, I guess it's a two-part question. So I'm really struck by the fact that there's no standards for training, which seems nuts to me. And you mentioned, I think, like, for instance, for the comfort dogs, the average was like 19 hours of training, I think you said?
That's actually for patrol and
okay, yeah. So my first question is, how much variance do you see in terms of how little training versus how much training? And then also, you mentioned in your survey that most of the respondents judged that their training was adequate or more than adequate, but how do they know if there's no standard?
Yeah.
And do you think there should be a standard that's set?
So lots of good questions. Okay, so for that survey, that 19 hours was very much a regional assessment of Massachusetts and New Hampshire handlers. And so I think they're doing far more. They set themselves to certain higher standards than what we've gathered nationwide. A lot of those handlers follow some of those national interest agencies that I described, who do have a minimum recommended training hour of 16, actually. So they're doing about 19 on average. And that's pretty equal between patrol and scent detection. I think it was like 19 and 20, or 20 and 19 and 20 hours or something like that, according to what I've collected. So they're trying to go above and beyond what some of their national agencies are recommending. But again, that's very regional here. Why they feel it's adequate or more than adequate is because of their role in their department policies in setting those standards, as well as the shared mentality in those regional training academies and regional LECs. So they take the information from the national agencies, and I think they have really good collaboration and partnership, at least here in New England from what I saw. And I went to quite a few of them to assess that. And I think they feel that way because they're working with their departments or with those law enforcement councils or their units to develop it. A couple of handlers did say that they felt it was inadequate, and that's because, and they clarified that, one that comes to mind is because they had just started their unit and were working on developing that policy with their department. So, and I can't remember the last question that you had. Was that it? Do I think? I think it would be yes, but there is a caveat to the state policy recommendations is a lot of times outside sources make recommendations for law enforcement in an era of reform. And so what I've spoken to handlers about is the fear that standards are going to be set without their input. And so that's why I went right to the law enforcement officer and say, well, what do you think? What do you feel? And there is some qualitative data in what they think that they would recommend. But how do we affect change together versus telling them what to do? I think there was one more question. Yeah.
Great talk.
Thank you.
A couple questions. So you put a statistic up in terms of veterinary encounters with the working dogs that you looked at, and only 4.5% needed a vet, and it was for blunt trauma.
Trauma, yep.
So can you break that down a little bit more?
Yes.
Was that injured on the job? Was that with, training injuries?
I'd have to go look back because we did have an opportunity for free text entry. I do want to clarify that statistic, and I forgot to put that and say that in the slide. That was in the past 12 months. So that is an important characteristic. That 4.5% of injuries was how many of your canines, or did your canine need veterinary attention in the last 12 months? And so 4.5% of respondents said yes, they did. And again, 80% of those respondents said blunt trauma. One was a stabbing, one was a shooting. But the actual blunt trauma, I can have to go back to that free text answers. Oh yeah, sorry.
When you were looking at the differences between kenneled and in-home working dogs,
Yes.
did you look at any health outcome measures? On the military, we have a very good idea of what type of kennel injuries and illnesses these dogs get.
Yeah.
And then, sorry, one last one. And then for the EOED dog distribution, that was mostly coastal, you said?
Was mostly what?
Mostly coastal for
Yes.
explosive ordnance.
Yep.
Could that be primarily driven by funding
Yes.
as well?
Absolutely. So to answer your kennel injury question, actually we don't have that data. That's not something we gathered or made an association with. The veterinary attention question was specifically about apprehension, following apprehension. So it doesn't relate to the housing, although that's a very good one. And then yes, I think funding, because we're working with municipalities, local municipalities, funding is a huge limitation that these cities and these city PDs have that perhaps state, federal, and military do not. And so they're dictated considerably by budget and resource limitations.
Is there any data about like depression in the dogs for finding traumatic things or not finding things they were supposed to find?
No, and I'm so glad you asked that. Not that I could find anyway, not that I've seen, at least in my research, so I won't say no conclusively, but not that I have found. And I think that is what is missing, and that's why that occupational health study I want to do would be in tandem between canine health assessments, which is what I could do as a veterinarian. I can't really assess humans, but I need a police physician to do that in tandem so we can see, particularly as a synchronized study, because a lot of the studies, at least the few studies that I've seen on any health assessment outcomes, have been delayed or staggered between the humans and the animals. And so they're not assessing them together in synchronicity. So necessary, very much.
Okay. Thank you so much.
Thank
Meera.
you.
That was really interesting. And we look forward to continuing to work with you.